I'm worried my son may have autism, a mom suggested during the consultation. Her 2-year-old was struggling with developmental milestones such as head control, lower tone, speech, and socialization, along with immune and behavioral struggles. She was beyond frustrated, trying therapies and medications, going from specialist to specialist, and still was not seeing real improvements. You could feel this mom was committed to finding answers. But at the same time, she was scared too. What are these symptoms adding up to? Do I have more to worry about for my child? How do I get out of this storm? Like this mom, you may have been told it's just bad luck or genetics, leaving you feeling helpless. But what if I told you that there is now strong scientific evidence that a cascade of events beginning even before birth could be affecting your child's developmental growth? These events are surprisingly common, yet often dismissed as harmless by pediatricians and traditional medical providers. In this video, I'll walk you through what we term the perfect storm, how factors accumulating as early as pregnancy and birth set off a sequence of events impacting nervous system development, draining immunity, and progressing into the chronic conditions plaguing so much of our children today. This video is for parents noticing subtle to more pronounced developmental delays or social disconnects in the baby's first 2 years of life that could potentially signal autism. I'll explain the key signs of autism by age range, so you understand what to look out for and when. I'll also cover suspected causes such as birth trauma and infections that may contribute, plus the important roles specialists like pediatric chiropractors play in support. While no two children are exactly the same developmentally, when we unpack delays, those associated with autism or a bigger diagnosis often have a sequence of struggles that we can observe. While autism affects communication and behavior, the sequence of struggles starts early on. While genetics play a role, environmental factors like maternal infections, prematurity, medications, and birth trauma involving oxygen deprivation or damage to the brainstem or upper neck also contribute. Add up all the perfect storm of stressors, and central nervous system development, signaling, and integration are greatly affected. This is why everything, although diagnosed differently, is so intricately interconnected. This is why it is so critical to identify autism early to optimize life function and quality. Here are some developmental signs to look for early on. Signs can appear as early as 3 months if babies don't reach milestones like eye contact, grasping objects, and bringing hands to mouth. Additional red flags at 7 months if not turning towards sound, laughing, or engaging with others. And by 9 months, not responding to names, copying gestures, or looking where others point could indicate autism. And more pronounced symptoms from 12 to 24 months if there is no speech, gestures, standing, or severe sensory sensitivity. Some pediatricians can dismiss delays, but early intervention provides the best outcomes, often through therapies. So why can neurologically focused pediatric chiropractic care help? The answer to this question is honestly very simple. It's simple because it all begins with our focus on that main, wildly important operating system, the autonomic nervous system and the vagus nerve. As a pediatric experienced trained doctor, I know there is no cure for autism, nor do I even treat it. We simply and safely restore balance to the autonomic nervous system by improving neuromotor tone, movement, and coordination. If a child has subluxation and dysautonomia, then even if they are getting all the other appropriate therapies, are on a perfect diet, are taking supplements, and so forth, they will struggle to see results as long as the nervous system stays in fight or flight mode, is disorganized, and inefficient. The storm begins to brew as soon as subluxation sets up shop. The earlier that subluxation and dysautonomia show up, and the worse that it is, the more likely a child will end up with more severe health and developmental challenges, such as autism. So if you have any concerns about your child's development, whether they are subtle disconnects or more pronounced milestones they haven't quite reached yet, it's important to trust your mom or dad gut and search for hope, answers, and drug-free help. To discover how we can help support children experiencing developmental delays and sensory issues related to nervous system dysfunction at the neurological level, please click the link in our bio to learn more. Our team wants nothing less than to help your child reach their full potential. If you're wanting to learn more and dive deep into what's really going on with birth trauma, prenatal stress, all the sicknesses and colds growing up, leading to behavior and emotional challenges, come to our Perfect Storm workshop tonight at 6:30 at the office. I'll be diving deep into all of this and what we can do to help.